Dealing with pain, swelling, or tightness in the back of your knee that feels like something's pinching? You might have a Baker cyst. In today's video, we'll dive into 5 effective rehab exercises to help you get relief and restore knee mobility. As an osteopathic practitioner and athletic therapist, I've worked with countless clients dealing with knee pain and swelling, all searching for effective solutions. So what is a Baker cyst? A Baker cyst is a small fluid-filled bump that forms at the back of your knee. Healthcare providers sometimes call a Baker cyst a popliteal cyst and synovial cyst. These are all different names for the same issue. Baker cyst develops when something damages your knee joint or the tissue around it and extra fluid drains out of your knee. The fluid can only go in one direction, and that is out the back of the knee joint. The buildup forms a fluid-filled sac, which becomes the Baker cyst. What are the signs and symptoms of a Baker cyst? The most obvious sign of a Baker cyst is the bump that forms at the back of the knee. Symptoms include knee pain, swelling inside and also around the knee joint, stiffness and difficulty walking, and limited knee flexion, trying to bring your heel towards your bum. Now, in my 15 years of clinical work, I have seen many people with Baker cyst and they weren't even aware they had one. And that's because it often doesn't produce symptoms, but people might just express tightness in the back of their leg. So I mention this because I don't want you to get worried about having one. It's quite common, and if you have symptoms, these exercises I'll run through with you today will be really helpful. And what are the causes of a Baker cyst? Anything that damages your knee joint can cause swelling and trigger a Baker cyst. The most common causes are different types of knee arthritises and injuries such as ligament sprains. So sprain to your ACL, PCL, MCL, or LCL, and strains of the muscles around the knee joint. So let's jump into the rehab exercises. So the first exercise we're gonna do, you are going to need an exercise ball or socks. We are gonna do wall slides. So this is a great way to reduce inflammation in your knee, improve range of motion, and you can easily do this at home. So lying on your back, you're gonna place the ball up against the wall, your foot in the middle of the ball, and you're slowly going to extend your leg up towards the ceiling. Try to get the quad firing a little bit there and slowly bringing your heel back down. This one you can come as far as you feel comfortable and extend all the way up as far as you feel comfortable. So you don't want to push into that pain range. If you find that the end ranges are a little bit too sore to do, you can just start nice and easy. So I love this one because gravity is assisting that inflammation to get it out of the knee and bring it towards your pelvis. Nice gentle exercise. You can start with 2 to 3 sets of 10 to 15 repetitions. Now the second exercise you're going to do is a dynamic hamstring stretch. So you don't need any equipment for this. We're going to do 2 to 3 sets of 10 to 15 reps, and you're going to lie on your back. You're going to clasp your hands behind your knee, and you're going to flex your ankle up towards the ceiling. Now, if this is too hard for you to hold the back of the leg, you can use a towel or a yoga strap. And I'm going to get you to extend your leg up towards the ceiling. You're going to keep that ankle flexed down so your toes towards your nose. Hold for 5 seconds, slowly come back down. You should feel a gentle stretch. It should not be painful. You should be able to feel a stretch through the calf here as well as your hamstring. And coming back down, and we perform 2 to 3 sets of 10 to 15 reps. Now, why this exercise is important is because if your hamstrings are tight, it puts compression on the Baker cyst. So we want to alleviate that tension. And the third exercise we are going to do is now a strength exercise. So we're going to do hamstring curls using an exercise ball. So we want to, after we've started to loosen up the hamstrings, we want to start strengthening them. And so I'm going to get you to lie on your back, arms down by your side, heels placed right in the center of the ball. And you're going to push down with your feet, lifting your hips off the table or off the floor, slowly controlling, bringing your heels towards your bum and slowly extending back out. So you can be the one who gauges how much range you can come in towards you and how much you can extend. So you want to make sure that you're watching your pain levels. And if this is too much of a progression, even still, you can keep your hips down on the floor, push into the ball, and then roll your heels towards you and slowly extend. So there's ways to modify this exercise. You can also do it with more support with your hands or less if you want to have your arms up and challenge your stability. So 2 to 3 sets of 10 to 15 reps for this one. The fourth exercise we're going to do is a banded leg press. So you need a TheraBand for this one. And what you're going to do is you're going to have a seat on the ground, wrap the TheraBand right around the ball of your foot. And this one's going to be to strengthen the quad muscles. So a bit of a progression. And you're going to bring your knee in towards your chest and slowly extend out. Okay, nice and controlled as you come in and as you extend. Again, monitoring your pain. So you don't want to be increasing your pain levels as you're going through this when you're really paying attention to just go before the pain starts. 2 to 3 sets, 10 to 15 reps. And this is a great way to progress if you are just doing your exercises from home and you don't have any gym equipment. Love using the TheraBand for this. But of course, if you have access to a gym, you can start using the leg press and just start on a really low load, higher repetitions, and again, monitor your pain. Now, the hamstring curls and the banded leg extensions are open chain exercises. So they are a little bit easier and a gradual way to progress into strength. The next and the final strength exercise that we're going to do is going to be a step down. And so this is a closed chain exercise. This is a bit more of a progression. So if you still find that standing is painful, that compression from your body weight is too much, then I would just stick with these 4 exercises to begin with. And then once you feel ready, then you can progress to this next exercise. So for the 5th and final strength exercise to strengthen the quads, you are going to need a stool. We are going to do step downs. Now, if you don't actually have access to a stool, you can use steps. You are going to stand with the affected leg on the stool. And what you want to do is you want to focus on keeping your core engaged, your pelvis in alignment. So you want to make sure that you're not dropping one hip down as you're trying to reach towards the ground. Trying to keep nice and stable. Also keeping the knee in line, I always say with the second toe for reference. It's okay for your knee to go over your toe. Don't worry about that. It means that you have great ankle mobility. But you want to stay nice and controlled through here. You're slowly going to come down. If you can't go all the way, say your pain maybe starts midway, stop there, come back up, and then repeat. You're going to do this 2 to 3 sets of 10 to 15 reps. You will probably be very fatigued after this one. So I really suggest you switch and alternate from left and right to give you a rest in between. And even if 10 to 15 reps is maybe a little bit too much, if you start at 5, fantastic. And just really monitor your pain, and then just don't push through that pain if you start to notice it creeping up. Now, the rule of thumb when it comes to the exercises and stretches, when you're dealing with an injury, you need to follow these key points. To keep it simple, for all the stretches, hold them for 3 sets of 30 seconds. And for the strength exercises, you'll do 2 to 3 sets of 10 to 15 reps. Now, if you have pain with any of these exercises, stop. Don't push through them, but if your pain is low and it doesn't increase while you're doing these exercises or after, then I encourage you to keep going and see how your knee progresses. If you notice an increase in swelling, then maybe try doing less repetitions, or maybe you've progressed to the strength exercises too quickly. Then maybe it's too soon to jump to those progressions and then start back from the previous exercise. In between each exercise, take 30 seconds to a minute break just to let your body recover. And for the stretches and mobility exercises, you can do these daily, even a few times a day. And if you're not seeing progression, then it's always a good idea to see your healthcare provider for an assessment and make sure that there's nothing else going on. So you might be wondering, how long does a Baker cyst last? As a therapist, I often get asked this question, and I always say, well, that depends on what caused it. A Baker cyst goes away as soon as the swelling goes down and your knee starts to heal. So usually within a few weeks, but it all depends on what injury you sustained. So when the underlying issue is treated, the Baker cyst will usually go away on its own. So just remember, there's always a way to stay functional and continue progressing, even when you're dealing with an injury, pain, or a setback. I hope now you have a clear understanding of how to improve your rehab for a Baker cyst and manage your pain effectively. If you found this helpful and you want to dive deeper, stay tuned. Don't forget to subscribe to this channel for more information on tips and injury prevention and recovery solutions. Thanks for watching, and I look forward to seeing you in the next video.